My presentation. Listen up. Okay. I'm definitely here to persuade. That is my motive. If you have any questions about what kind of topic this was going to be on, look at the door. It's right there at the door. I'm here to persuade my audience to avoid having a cesarean section to give birth. You all know that cesarean sections present many risks, but a lot of you don't even know what these risks are. Well, I'm here to tell you that cesarean sections present risks in the short term and in the foreseeable future. For example, breastfeeding. Yes, they do cause risks to breastfeeding. It's very important as a mother that you breastfeed, and you don't want any complications with the breastfeeding. So you must understand, in order to breastfeed properly, you must be checking with the doctor often if you have a C-section to make sure there's no complications. Urinary infections, they are common when it comes to C-sections. Also, you would have pain. You can have blood and disorders. Well, what I mean with blood is blood clots. Yes, they do cause blood clots. Whenever you get cut open, there's always the risk of a blood clot around the veins. You can also have a long recovery time. Giving birth does mean you're going to be in the hospital, but with a C-section, it is much different. You will be in the hospital for a long time, having a long recovery time. There's also hemorrhaging. You think you're healed up, but with a C-section, the cut can always open back up, and you can hemorrhage internally. So C-section can also pose other problems. These are much more minor problems, but they are problems nonetheless, and people are concerned with these problems. For example, sexual dysfunction. C-sections cause sexual dysfunction. In some cases, infertility. You're already having a baby. Well, guess what? That may be your last baby. Sad to say, but it does happen. There's also really bad pelvic pain. I'm going to talk into more about that in detail, but that is a really common issue a lot of women have, is the pelvic pain with the C-section, and I'm sure you would want to look into this after this class. There's also emotional distress. I'm not talking about postpartum here with emotional distress. I'm talking about emotional distress due to the cesarean section. Having a cesarean section can be risky. So here's a couple of reasons why I think you shouldn't have one. For example, there could be a lot of difficulties after birth. There's short and long-term effects due to the cesarean section, and there's really bad pelvic pain. There's a lot of information showing that C-sections could lead to extreme and difficult problems. Some problems are very extreme, some problems are very difficult. There's a lot of information showing that C-sections can actually cause many women to go back to the emergency room for the C-section due to complications with the C-section. A lot of women claim they've been in and out of the hospital due to C-sections. You can also have a baby suffering from not being delivered regularly, vaginally. They can have difficulty breastfeeding. I'm not talking about anything wrong with your milk. I'm talking about something wrong with the baby. Also, the baby can have respiratory problems. You don't want your baby not breathing. Have you heard of infant death syndrome? You want your baby to have as good a respiratory system as possible. They also suffer from colic. I can see some of you got a little scared when I said that. Yes, they can suffer from colic due to the C-section. Cesarean sections can also have its short and long-term effects. I'm going to start off with some long-term effects. For example, surgeons can cut your bladder and bowels. Yes, they're professionals. It is an accident, but it does happen. They cut you, they can cut your bowels. Not to mention, they can also cut the baby. Yes, it happens. Also, once they close you up, your wounds can reopen. What's to say that they won't reopen? There's no air in there drying your wounds to help it scar up. It will scar, but it's not going to scar the same way a scar out here scars. It scars differently internally. There's also going to be a lot of pain and numbness around the scar. But on the flip side, there can also be extreme pain. And numbness is numbness, but imagine feeling like you're missing something in the inside. That's because you don't feel it no more. There's also some short-term effects associated with the C-section. For example, a lot of people are going to criticize me for throwing costs in here, but C-sections do cost much more than a regular vaginal birth. And it should. It's more work, and it's also more dangerous for the doctor to perform. You also have to stay longer in the hospital. I'm not talking about the week average that most women spend in the hospital. Most women Like I said, they spend a week in the hospital on average. But with the C-section, you could be looking at a month or two. That's just how it is. The baby can also be cut by the doctor's scalpel. May not be serious, it may be very serious, but the baby's right there under your skin, and they're cutting to get the baby out. It can happen. You have to be very careful. Well, your doctor has to be very careful. Pelvic pain has a lot to do with this study. Actually, pelvic pain due to cesarean sections is very common. In fact, there was a study from January 1989, January 1989 to 2000, and actually 67% of these women of the C-sections that actually had C-sections reported extreme pelvic pain, while another 31% of these same women reported inflammatory disease. And let me go more on the pelvic pain. It can continue for a long time. There's no time frame on this. It can be with you forever. It's very possible. This actually could be due to the scar tissue and the growth of adhesion tissue. There's around 38% of the women who have had pelvic pain due to the adhesions. It limits movement of the internal organs. Imagine scar tissue. Scar tissue is not like normal tissue. It doesn't stretch. It has little feeling. It's basically like a piece of wood. So imagine organs trying to do their thing with scars on them. It just doesn't really work out too well. That's where you get your numbness. That's where you get your pain. Cesarean sections can have short and long-term effects. As I said, you can have difficulties after birth, and you can have bad pelvic pain. C-section is more risky than a natural birth, and at least very much more expensive. There are many complications with the C-section, so unless you have a C-section and it's really necessary to have it, then you should just go for the natural birth. There's also shots they can give you called the epidural to take the tension off the birth so it doesn't really hurt as much. I would just go with the epidural. Some of my sources were Village Pros and Cons, Assortment Lifestyle, and ddonacria.com today. Thank you very much, class. If you have any questions, I'll be in the hall, but